Welcome to the Depression and Anxiety Overview presentation. This presentation acts as an introduction to these two common conditions. In this presentation, we will cover symptoms, causes, assessment, and treatment options for depression and anxiety. At the end of this presentation, I have included some additional resources for you and your future patients. We're going to start with depression. Everyone occasionally feels sad or has some days when they're feeling down. However, with depressive disorder, these feelings interfere with daily life, normal functioning, and can even cause pain. Now, depression may be common, but remember it is a serious illness. In this presentation, we will focus on major depressive disorder, or MDD. This is the most common diagnosis when referring to depression. The DSM-5 is the Manual for Diagnosing Mental Disorders. A diagnosis for MDD must meet two criteria. 1, the patient must have at least 5 symptoms at the same time. And 2, these symptoms must be present most of the day, either daily or nearly every day, for a total of 2 weeks. As you notice from this list, symptoms can be emotional, physical, or intellectual. These symptoms include a depressed mood during most of the day, loss of interest or pleasure in almost all activities nearly every day, fatigue or loss of energy, feelings of worthlessness or guilt, impaired concentration or indecisiveness, insomnia or hypersomnia, recurring thoughts of death or suicide, a sense of restlessness or agitation or being slowed down, having slow thinking, or significant weight loss or weight gain. So this is defined as a change of more than 5% of their body weight within 1 month. The asterisks are key signs of depression, so these are typically either depressed mood or loss of interest or pleasure in activities. There is no single known cause of depression. It is likely the result of a combination of biochemical, environmental, psychological, and genetic factors. It is thought to be an imbalance of neurotransmitters, specifically norepinephrine, serotonin, and dopamine. It may also result from changes in receptor sensitivity to these neurotransmitters. Depression could also be related to environmental factors. These include major events like physical, sexual, or emotional abuse, conflict, death, or loss. It may also be due to medications, such as the smoking cessation agent varenicline or Chantix, blood pressure medications like beta blockers, medications for acne, or hormonal therapies. Or depression may be related to health conditions like thyroid disorders or substance abuse. Psychological factors for depression include self-esteem and coping skills. Finally, it is also thought to be genetic, so a family history may increase your likelihood of having depression. These are some tools used to assess depression. You may see any of these scales used in practice. The first one, the PHQ-9, is most common in outpatient clinics. Patients are asked to self-rate 9 statements using a scale from 0 to 3, 0 being not at all, and 3 being nearly every day. This tool is based on the DSM-5 diagnostic criteria that we talked about previously. There's a link to the tool here. Beck is also self-rated, but is longer than the PHQ-9, with patients rating 21 items, and is used to measure the severity of symptoms. Unlike the other two, the Hamilton scale for depression is clinician rated and used to assess the severity of depression. Now we'll move on to treatment options. Psychotherapy or talk therapy and counseling are effective treatment options for clinical depression. However, on its own, therapy may not be enough, but it does play an important role. Research suggests that therapy combined with the use of antidepressants works better than antidepressants alone. Some patients who don't respond to standard treatment options may be candidates for ECT or electroconvulsive therapy. Medications are common treatment options for depression and work by correcting the imbalance of neurotransmitters. Common classes of antidepressant agents are listed here on the slide. We will cover these in more depth in the depression and anxiety presentation. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are the most commonly used medications to treat depression. These would be considered your drug of choice or first line. A dopamine reuptake inhibitor may be used on its own or in a combination with an SSRI or SNRI. Tricyclic antidepressants, TCAs, are older agents, and because of their side effects, are used less commonly for depression. Monoamine oxidase inhibitors, or MAOIs, we will not cover as they are rarely used to treat depression due to life-threatening drug interactions. The link on the slide will bring you to an animation on how neurotransmitters function and how this affects patients with depression. Now we're going to switch gears a little and move on to anxiety. Anxiety is a normal reaction to stress that everyone experiences at times. It is common to feel anxious when faced with a difficult situation or problem, before taking a test or making an important decision. However, anxiety disorders are different. When the worrying and anxious feelings become excessive, you experience irrational dread of everyday situations. This would be considered an anxiety disorder. Anxiety is a disabling disorder that interferes with the patient's ability to function. As you can see on the slide, there are many different types of anxiety disorders. The first is generalized anxiety disorder, and it's described as excessive, unrealistic worry and tension, even if there's nothing there to provoke anxiety. Next is obsessive-compulsive disorder, defined as constant thoughts or fears that cause a patient to perform certain rituals or routines. Disturbing thoughts are obsessions, and the rituals are compulsions. Panic disorder is described as feelings of terror that strike suddenly and repeatedly without any warning. Post-traumatic stress disorder can develop following traumatic and/or terrifying events, sexual or physical assault, unexpected death of a loved one, or natural disasters, for example. Patients suffering from PTSD have lasting and frightening thoughts and memories of the event. Finally, we have social anxiety disorder, which is defined as an overwhelming worry and self-consciousness about everyday social situations. This disorder centers on the fear of being judged by others or causing embarrassment or leading to ridicule. These are common symptoms of the different types of anxiety disorders. I wouldn't expect you to recall all of this information, but I would expect you to be able to identify the key differences between these different types of anxiety disorders. Similarly to depression, there's no single known cause of anxiety. It's likely a combination of biochemical, environmental, psychological, and genetic factors. It is widely thought that anxiety involves an imbalance of neurotransmitters, specifically inhibitory neurotransmitter GABA, and potentially serotonin. Receptor dysfunction is also likely a cause, particularly in regards to GABA. Environmental factors such as trauma, stressful events like abuse, death of a loved one, changing jobs or schools likely play a role as well. Additionally, anxiety can be drug-induced or caused by the withdrawal from certain medications. Anxiety can also be linked to the use of and withdrawal from addictive substances like alcohol, caffeine, and nicotine. Psychological factors and genetic factors are also contributing factors. A family history may also increase the likelihood of developing an anxiety disorder as well. For assessing anxiety, you may ask screening questions related to the symptoms or use a similarly validated tool as we discussed with depression. Now on to treatment. Drug selection is guided largely by timing, so whether anxiety is acute or chronic. Highly acute anxiety is commonly treated with benzodiazepines. On the other hand, chronic anxiety is treated with SSRIs. SSRIs are the drug of choice. There is also a miscellaneous agent called buspirone that acts as an anxiolytic. Again, we will cover these medications in more depth in the depression and anxiety presentation. To wrap up this presentation, here are some additional resources. The National Institute of Mental Health and the National Alliance on Mental Illness are two excellent resources for both depression and anxiety. They provide information, programs, and resources for healthcare professionals, patients, family members, and caregivers. Finally, the American Psychiatric Nurses Association is a more specialized resource for nurses working or specializing in mental health or psychiatry.